Education on RSV in children. So what is RSV? RSV is what's called the Respiratory Syncytial Virus. It's a viral illness that causes symptoms such as trouble breathing. It's the most common cause of inflammation in the small airways in the lungs, the bronchiolitis, and pneumonia in babies. With masks off and kids back to school, respiratory infections are making their rounds. In New York alone and across the nation, a surge in cases of respiratory syncytial virus or is putting parents and doctors on alert, and is also overwhelming our hospitals. What causes RSV? RSV is spread when a child comes into contact with fluid from an infected person's nose or mouth. This can happen if a child touches a contaminated surface and touches his or her eyes, mouth, or nose. It may also happen when inhaling droplets from an infected person's sneeze or cough. Now that more people are out and about en masse and in crowds, the virus is circulating again. People who are susceptible to the virus are becoming infected, including some older children who never have had RSV before because of masking and distancing over the past 2 years. The uptick in infections this year may also reflect a more aggressive RSV season. Which children are at risk for RSV? A child is more at risk for RSV if he or she is around other people with the virus again. RSV often occurs in yearly outbreaks in communities, classrooms, and childcare centers. RSV is more common in winter and early spring months. It can affect persons of any age, but causes the most problems in the very young and very old. Most babies have been infected at least once by the time they're 2 years old. Babies can also be reinfected with the virus. Infection can happen again anytime throughout life. RSV infection in older children and adults may seem like an episode of severe asthma. Babies born prematurely or with heart, lung, or immune system diseases are increased risk for more severe illnesses. How is RSV spread? From person to person. Most do, again, cough and sneezes. Children can get it when respiratory droplets containing the virus enter their eyes, nose, or mouth. RSV can live outside of the human body for many hours, so it is also possible for children to pick up the virus via contact with contaminated surfaces. That can happen when little hands handle germy objects such as doorknobs and tables, and then children touch their eyes, nose, mouth before washing their hands. What are some of the symptoms? Symptoms start about 2 to 5 days after contact with the virus. The early phase of RSV in babies and young children is often mild, like a cold. In children younger than age 3, the illness may move into the lungs and cause coughing and wheezing. In some children, the infection turns into severe respiratory disease. In infants, RSV may show up in other ways. Your child may be irritable or less active or less hungry than usual. Their nostrils may flare, their stomach looks like it is being sucked in, and the rib cage becomes more accentuated. This child needs medical care. If a baby's blood oxygen level dips, the lips may appear bluish in color. Your child needs to be treated in the hospital to help with breathing. The symptoms of RSV can seem like other health conditions. Make sure your child sees his or her healthcare provider for a diagnosis and treatment. Some of the most common symptoms that are being seen, again, runny nose, sneezing, fever, cough, short periods without breathing, apnea, trouble eating, drinking, or swallowing, wheezing, flaring of the nostrils, breathing faster than usual or trouble breathing, and again, turning their lips turning blue or even their fingertips. This is just some pictures showing you the signs and the symptoms. How is it diagnosed? The healthcare provider will ask about your child's symptoms and health history. He or she may also look about any recent illness in your family or other children in childcare or school. He or she will give your child a physical exam. Your child may also have tests, such as a nasal swab or wash. This is a painless test to look for the virus in fluid from the nose. Now, sometimes people worry, is it a flu? Is it COVID-19? Or is it RSV? RSV produces some of the same symptoms as flu and COVID-19. Cough and fever are common symptoms of each infection. They are present very similarly. So how do you know if your child has RSV and not another respiratory virus? One telltale difference, kids with RSV usually do not develop GI symptoms like nausea, vomiting, or diarrhea. GI involvement is more common in cases of the flu and COVID-19 in children, while RSV, for the most part, is limited to upper respiratory tract infection. If a child has moderate to severe symptoms, your child's doctor can test for each of these viruses to help determine the treatment. If it's the flu, your doctor can prescribe medications for that, approved to treat flu in children 2 weeks of age and older. Whether it's the flu, COVID-19, or RSV, you should keep your child home to recover and prevent others around your child from getting sick. What viruses do you have? The symptoms for COVID-19, as I just went over, RSV and flu differs, but some also may have allergies. So we want to make sure that we're able to differentiate all four. How is it treated? Treatment will depend on your child's symptoms, age, and general health. It will also depend on how severe the condition is. Antibiotics are not used to treat RSV. Treatment for RSV is done to help ease the symptoms. So treatment may include more fluids, oxygen, suctioning of mucus, bronchodilator medicines, tube feedings. This may be done if a baby has trouble sucking. A thin tube is put through the baby's nose and down in the stomach. Liquid nutrition is sent to that tube. Mechanical ventilation. A child who's very ill may need to be put on breathing machine to help with the breathing. And sometimes antivirals are given. Some children with severe infections may need treatment with an antiviral medicine. What are the possible complications of RSV in a child? In high-risk babies, RSV can lead to severe breathing illnesses. This may become life-threatening. RSV as a baby may be linked to asthma later in childhood. RSV typically lasts a week or two, and most kids get better on their own, but the virus can cause more serious infections. Some RSV can lead to bronchiolitis, an infection of the lower respiratory tract, or pneumonia, a lung infection. Infants, especially those under 6 months of age, are particularly vulnerable to having more severe RSV. The smaller airways lower down in the lungs get inflamed and get more plugged up and narrow. Very young infants and babies born prematurely are even more prone to serious infection, as are children who have heart and lung disease. How can I help prevent RSV in my child? The American Academy of Pediatrics recommends that babies at high risk for RSV get medicine called palivizumab. Ask your child's healthcare provider if your child is at high risk for RSV. If so, ask about monthly injections during RSV seasons to help prevent the infection. To reduce the risk of RSV, the American Academy of Pediatrics recommends all babies, especially preterm infants, be breastfed, be protected from contact with smoke, not go to childcare with lots of children during their first winter season, not have contact with sick people. Encourage washing hands frequently with soap and water. You want to teach your child that when they're washing their hands, they sing the happy birthday song twice. And you teach them how to rub their hands together, go under their fingernails, wash the back of their hands. It is key that they're taught how to wash their hands appropriately. Teach how to cover when they cough and sneeze by sneezing in their elbow, not in their hands. So then they'll put their hands to their face. Help your child keep germy hands away from their eyes, nose, and mouth. Avoid close contact with people who are sick. No kissing, handshaking, or sharing cups and utensils. Disinfect frequently touch surfaces and stay home if the child is sick. Parents make sure that household members wash their hands or use alcohol-based hand cleaner before and after touching a baby with RSV. How can I help prevent RSV in my child? Make sure, again, your child receives all the recommended immunizations. Vaccines won't prevent your child from getting RSV or other viruses that cause colds, but they will protect your child from some of the complications cold can cause. There's a special injection in RSV infection called, that I described before, but is only given to children at risk for severe RSV, mainly babies with heart and lung disease or those who were born very early. it has to be given monthly during that season. I just went over how some of those tips, how to prevent it. Now, RSV now is the leading cause of hospitalization in infants. Each year, the U.S. estimates approximately 58,000 hospitalizations among children younger than age 5 years old. RSV is also a major cause of hospitalization and mortality for adults 65 plus, leading to an estimated 177,000 hospitalization and 14,000 deaths. It can get very serious very quickly. What can I do if my child is sick? Keep your child as comfortable as possible and offer plenty of fluids. Some doctors may recommend giving acetaminophen or ibuprofen for fever. Ibuprofen should only be given if your child is drinking reasonably well. Why? It can cause ulcers if your child has nothing in their stomach and they're taking these medications. Do not give ibuprofen to babies under 6 months old without first talking to your doctor. If your baby's having trouble drinking, try to clear their nasal congestion gently with a bulb syringe or with saline saltwater nose drops. If you don't know how to do it properly, then don't attempt to take the baby to the doctor or to the hospital. Do not give over-the-counter cough and cold medicines to a child younger than 6 years old. Although these drugs do not need a doctor's prescription, they are not safe for young children. We also have to remember that things that acetaminophen and some medications have substances that can further cause liver damage. So you want to make sure that you're speaking to a provider before you administer certain medications. If you're using cough and cold medicines for children older than 6 years old, read the instructions carefully and give only the recommended dose. Tips to help you get the most from a visit with your child going to the healthcare provider. Know the reason that you're visiting. Write down any questions before you get to that provider. Most parents, by the time they get to that doctor's office, they forget a lot of their questions. And when they leave, that's when they remember. So it's important that you want to write your questions down so you can get your questions answered. At the visit, write down the name of any new diagnosis, any new medications and treatment and tests, and ask questions about those things. Know why a new medicine or treatment is prescribed and how it will help your child. Also know what the side effects are. Ask if your child's condition can be treated in other ways. Know why a test or procedure is recommended and what the results could mean. Know what to expect if your child does not take the medicine or have the test or procedure. If your child has a follow-up appointment, write down the date, time, and purpose for that visit. Know how you can contact your child's provider after office hours. That's key because most kids, it's in the middle of the night that they start getting ill. So you want to make sure that you have a contact for a provider that you can reach if you have questions at that point. This is important if your child becomes ill, as I stated, and you have questions and need advice. Caring for a sick child can be distressing, and parents can be assured that RSV is a common childhood virus. Most cases can be treated at home, but those few children who do require hospitalization receive supportive care and fully recover. Key points to remember about RSV. RSV is a viral illness and can cause trouble breathing. Anytime a child is working hard to breathe, that is a sign of distress and that needs immediate attention. Children who are having difficulty breathing need to go to the emergency department. Most babies have been infected, at least again, as I stated, once by the time they are 2. Treatment for RSV may include just some extra oxygen given through a mask, nasal prongs, or an oxygen tent. A child who is very ill may need to be put on a breathing machine to help with breathing. In high-risk babies, RSV can lead to severe respiratory illness and pneumonia. This may become life-threatening. RSV as a baby may be linked to asthma later in childhood. Babies at high risk for RSV receive medicine. Ask your child's health provider if your child is at high risk for RSV. I want to give special acknowledgement to Cedars-Sinai Medical Center, NYU Langone, Cleveland Clinic, OSHA and Canada.org for the information that I provided to you today. If there's anything that I did not cover in my summary and you have any questions, I ask that you join us in the Zoom room at the end of the service. Thank you for your time. God bless you and have a wonderful rest of the week.